Good afternoon. My name is Tracy Velasquez, and I'm Policy Director of the Council of Court Excellence. Thank you for joining our briefing on key findings from our report that was released this week, Urgent Need for New DC Jail. With me today are Crystal Nieves Murphy, who is our Open Horizon Fellow, Magdalena Changas, who is Policy Manager, and Katie McConville, who is Policy Counsel here at the Council for Court Excellence. We'll be presenting some of the key findings from this report, and we will have time at the end to answer questions. We'll have a Q&A open, and we'll answer questions that are submitted into the Q&A box on Zoom. We are recording this presentation, and it will be available relatively soon on the CCE website and on social media. So just a quick introduction to the report. This report was done in collaboration with the Office of the District of Columbia Auditor, and we were asked to do a study of the conditions of the DC jail. The period of time that we are looking at in which this audit covers is July 1st, 2023 to June 30th, 2024. So the findings are specific to this period of time. We know that there may have been changes that have happened since then, and that is beyond the scope of this report to look at those changes, look at how lawsuits were settled, those sorts of things. So please keep that in mind when looking at the findings that we're presenting today. We used a variety of methods for the research that we did. The primary methods were looking at statistics and information and data provided by the Department of Corrections, by the DC Department of General Services that are available online to the public and on various websites. We supplemented this with interviews with individuals who were incarcerated at the jail during the audit period, with service providers who had firsthand experience in the jail, and others with experience in the jail themselves or through loved ones. We are excited to present this information because of the ongoing concerns with the jail. This report follows up on the report that was done 5 years ago by the auditor on a need for a new jail. And as you'll hear, the concerns expressed there have continued, and the key finding that you'll hear from will be that we do believe that the need for a new jail persists and has gotten even more dire in the years since. Let me just talk a little bit about the statistics about the jail, and then we'll launch into our audit findings. One of the first statistics that I wanted to share with folks is that when you look at the District of Columbia compared with other cities around the country, DC incarcerates a larger share of our residents than other places. The DC incarceration rate is 50% higher than the national average. And in addition to that, the number of people in the jail has been growing. Over the audit period, the number of people in the jail grew 41%. From 1,384 to 1,945 people, and that's an average daily population. In addition to that, the length of stay, how long people stay at the jail, has grown. While many people stay months or weeks, there are a number of people who are staying much longer, and this is increasing the length of stay at the jail. The national average length of stay is 39 days. At the DC jail, the average length of stay was 96.5 days for men, and men make up the lion's share of the population. So we're looking at a length of stay that is over twice the national average. This is partly a result of the length of time that is taking for cases to get resolved. Many of the folks in the jail are there pre-trial. We know that lengths of stay case time has gotten longer as we've seen judicial vacancies remain open, and this is creating part of the crisis of the number of people in the jail and the length of time that they're staying there. And when you look at how the jail is being used, most of the jail on a daily basis is being filled by people there for over a year. So this is usually called bed days. And what we've seen is that 63% of bed spaces during the audit period were taken up by people in the jail for a year or more. And about 40% of the jail space is being taken up by people there over 2 years. So what we're seeing is that many people are in the jail and many of them are there for a very long time. With this, I'll pass the baton over to Katie to talk about, I can figure out how to do that. The need for a new jail and what we've known about that.
Thanks, Tracy. So DC has known about the need for a new jail for over a decade. In 2010, DOC requested capital funding for a new jail and has consistently renewed requests for either funding a new or renovated jail facility in the decade plus since their initial request. More recently, in 2019, the Office of the DC Auditor recommended a new facility be constructed, explaining that the seriousness of facility problems clearly point to the need for a new jail. In 2023, Mayor Bowser selected CGL as the architect consultant for the Correctional Treatment Facility Annex, and in August to September of that year, CGL presented a plan for a replacement jail facility with 832 beds and an estimated cost of $936 million. In November of 2023, that same year, the plans for the new jail changed to a phased approach, with 445 million allocated for phase 1 and 667 million allocated for phase 2. These phased plans were released, and following public pressure, in 2024, DOC said they would add about 380 general population beds to phase 1, with a plan that a majority of male residents would still remain in the Central Detention Facility, CDF, for over a decade. Most recently, on Tuesday, the mayor's office announced in the DOC budget drop a plan for private funding of the jail, where DC will seek out a private investor to fund a new jail that the DC Department of Corrections will operate. There is not any additional information about the number of beds, timelines, or other details about this proposal. I'll now pass to Crystal to discuss jail conditions.
Thank you so much, Katie. Our audit discovered persistent maintenance issues. There were 1,595 issues noted in the Priority 1 work orders during the audit period. Priority 1 work orders are defined as deficiencies seriously affecting health, safety, and security which occurred during the audit period. There were many instances where residents' health and safety were jeopardized because of lack of repairs, such as broken and malfunctioning plumbing, wiring, cell doors, locks, keys, and gates. Issues in need of repair were rampant in both common areas and in resident cells. In many weeks, more than 20 different cells would have the same issue in the same unit. These issues often had to do with dirty walls or floors, broken doors, varying water pressure, or damaged light covers. Smoke detectors often needed to be repaired, which is concerning as there were 22 fires during the audit period. In one episode, a resident said that the fire alarm did not go off, causing a large amount of smoke and leading to many residents having nightmares or fears regarding the fires. The temperature in the jail has also led to many issues. Some residents stated that having the temperature be too hot was used as retribution for speaking out about conditions. Residents also stated that the temperature in the jail was known to fluctuate wildly both from day to day and from area to area. The lack of digital and systematic reporting prevented DOC from analyzing repeat and systematic conditions, problems, and exacerbated the issues. Reports are filled out by hand with a simple yes or no answer, often without further elaboration. The poor jail conditions have resulted in many costly litigations against the district. I'll go ahead and pass this back to Tracy.
Thank you, Crystal. One of the issues that has gotten a lot of attention over the past year has been the rate of deaths at the jail. CCE looked at death reports and information provided by the Department of Corrections around the deaths in the jail, and what we found was that there were 8 deaths of people in DOC custody at the jail during the audit period. And this does not include an individual who died by suicide at the central cell block, as that was not part of our audit. Among these deaths, there was one suicide, one homicide, which was a resident who killed another resident, a physical medical health emergency, which resulted in an individual's death, and 5 drug overdoses. So you'll see on the table here, we have a comparison of deaths per 100,000 jail residents with the United States in 2019, which is the most recent data that's available, compared with combined CDF, Central Detention Facility, and the Correctional Treatment Facility, or CTF. What you see there is that the causes that the rate of deaths at the DC jail was 3 times the national average. And drug overdose deaths were 10 times the national average of deaths reported by jails nationally. When we looked through the death reports, what we saw was that in a number of them, staff action or inaction were contributing factors in the individual's death. And one, insufficient staff were utilized to move from one building to another. In others, there were lapses in terms of how often cells were checked. I would also what we noticed is that while the police come when the person has died, and there is the chief medical examiner does a review of the individual's deaths, we were not made aware of any internal process that looked at analyzing the circumstances of the death. For example, of the 5 people who died by overdoses, were people interviewed? Was there any information that was gathered from cameras or other sources on how that individual might have gotten access to drugs, for example? And what we also found was that there was little information on the circumstances of death shared with families or the public. And we know that this is something that has come up before. There was legislation passed to increase the reporting and the information on deaths in custody. And that was something that we wanted to make sure that we noted as well. With that, I'll turn it over to Katie.
Our audit also found that the jail faced short staffing, spent millions on overtime, and uncovered many issues with staff culture and misconduct. Vacancies and short staffing make the jail less safe for residents and staff alike. In a survey conducted in late 2023, 45% of jail residents responded that correctional officers were not always available when needed on unit, and 15% of positions in the Department of Corrections were vacant at the end of the audit period. Alongside resident safety, staff safety and well-being can also be diminished by the reliance on overtime to meet staffing needs. Per DOC policy, staff can be mandated to work back-to-back 8-hour shifts, with officers reporting working overtime as often as 5 of 7 days a week. During the audit period, DOC spent over $30 million on overtime. Moreover, the budget for training more than 1,000 staff in 2024 was $85,000, down from $209,000 in 2022. And there were multiple instances during the audit period where body-worn cameras were not activated as required during key incidents, including deaths in custody. Turning now to staff morale, culture, and misconduct, there was also an alleged pattern of retaliation against both jail residents and staff who assert they have been sexually assaulted or harassed, and a persistent problem of female staff and volunteers reporting being sexually harassed while working in the jail during the audit period. Multiple lawsuits were settled during the audit period concerning sexual harassment of staff. In addition to sexual harassment, there was alleged discrimination in the jail as well. Both staff and residents have cited harassment, low morale, and policy violations. For example, DOC sent 15 complaints to the Equal Employment Opportunity Commission alleging discrimination during the audit period. Alongside culture issues, there's also a lot of misconduct related to contraband in the jail. During the audit period, 2 former DOC staff members were found guilty of, and 2 others were charged with bringing contraband drugs and weapons into the jail. This slide shows pictures of contraband seized during the audit period, showing plastic food containers and contraband material they contained, including a switchblade knife, drugs, a phone, and other items. I'll now pass to Magdalena to discuss violence in the jail.
Thank you, Katie. Looking at violence and use of force in the jail during the audit period,
there were 790 assaults reported during that year. 580 of them involved only residents, 2/3 of which occurred at CDF. 210 of those assaults were on staff. Important to note, of those assaults on staff, 78 were classified as assault with liquid, which includes water. These incidents perpetuate an atmosphere of fear and violence that leave both staff and residents traumatized. Fights and assaults have a number of negative consequences, including injury, including related healthcare costs, potential death, solitary confinement, disciplinary action, which of course can limit privileges such as visitation. Furthermore, there were 400 use of force incidents from staff recorded during the audit period, many of which used pepper spray. Of these incidents, only 1 in 4 were related to violence between residents. We reviewed significant incident and extraordinary occurrences over 5 randomly selected weeks during the audit period. In these weeks, all 46 cases of use of force included the use of pepper spray. 39% of these instances involved claims of non-compliance with institutional rules, including various levels of seriousness, such as having an arm out of a food slot, refusing to be searched, refusing to go back into a cell, etc., that resulted in pepper spray or another use of force. There's also a potential of underreporting of these uses of force. The documents that we reviewed during the audit period from DOC, including informal and formal grievances for 1 week, revealed 2 additional cases of allegations of use of force by staff that were not included in the significant incident reports. In one instance, the resident reported being punched in the head by a correctional officer while handcuffed. In its 2024 performance oversight hearing before DC Council, DOC reported no alleged staff on resident assaults for all of 2023. However, in data covering the entire audit period, DOC reported 6 alleged staff on resident assaults, 5 of which occurred in 2023. Finally, there have been sexual harassment or abuse complaints from residents and a few ongoing lawsuits from residents citing claims of sexual abuse from staff. Female staff also reported being sexually harassed by residents and by other staff, but reported that these cases often go unreported. And we'll move on to healthcare. The jail is not consistently meeting the healthcare needs of residents. Residents reported missed medical appointments and medication delays. A class action lawsuit brought by Washington Lawyers Committee provides many in-depth details about these health conditions faced by multiple people in the DC jail. Health issues were the most common reason that people filed grievances. One resident in this class action suit claimed they had 13 or more outside medical appointments canceled by jail staff, with understaffing being given as the most often as the reason for the jail's inability to transport the resident. Multiple people who were interviewed for this audit indicated that understaffing was a factor when DOC or its contractor canceled outside medical appointments for residents. Furthermore, approximately 70% of all DOC residents had an identified mental health issue at intake at the start of the audit period. 2 out of 3 of people with a mental health issue were being housed in general housing. However, there's also 37% of behavioral health staff positions that were vacant during the audit period. We conducted a limited survey of former jail residents who were at the Bureau of Prisons, and of these, 45% reported witnessing or experiencing mental health struggles every day while in custody. In particular, there are 48 residents a month on average being placed on suicide watch or precaution. While preventing suicidal individuals from accessing items that can be used to self-harm is paramount, these safe cells where individuals are placed are intended to protect them from that harm and require that people should have 30 minutes of out-of-cell time per day. They may have access to some physical personal property items, but that is discretionary, and lights are on at all times for people in the safe cell. A former resident shared he spent 6 months in a safe cell. In practice, We've heard from staff, attorneys, incarcerated individuals, and service providers who all raised concerns about the use of safe cells in DC jail. This includes lack of access to showers, water being punitively shut off by staff, lack of blankets, rampant rodents, access to materials used to self-harm while in these safe cells, and cells covered in feces. In a letter from an individual whose loved one died by suicide in the DC jail, she shared she could not imagine anyone verbalizing to staff that they were suicidal because they knew that they would be further punished in one of these suicide precaution cells. Finally, there were 148 doses of Narcan administered during the audit period. DOC shared to council in February 2024, about 40% of the incarcerated population is diagnosed with a substance abuse disorder, primarily opioid use disorder. While DOC has been recognized nationally for its provision of medication-assisted treatment for residents with opioid disorders, this translates to about 265 people a month being treated for opioid use disorder in the jail. Another avenue to reduce the number of people in jail with substance abuse disorder is to stop them from entering in the first place. CCE's February 2024 report to ODCA on compliance with recommendations regarding reducing number of people in jail with behavioral health disorders found the need for a more strategic approach to pre-arrest diversion. And I will pass to Katie.
Thanks, Magdalena. Now we're going to turn to food. Food safety in the DC jail is in crisis. Grievances allege that food was contaminated with inedible bugs, inedible objects, and even screws. One resident claimed he swallowed a screw, leading to a lawsuit. Another claimed bugs were deliberately planted in their food as retaliation. Even staff acknowledged that the food was unacceptable. A correctional officer said they, quote, wouldn't feed that to a dog. With the food quality inspector working limited hours outside of critical meal times, residents reported eating spoiled, cold, and potentially unhealthy meals without sufficient oversight. Residents' dietary needs were also ignored in several instances during the audit period. For example, medical dietary needs were disregarded when a resident with a severe peanut allergy was served peanut-containing meals 8 times in 1 month, putting their health at risk. Additionally, there were claims that food was used as a form of punishment. One resident's religious meals were allegedly revoked after filing a grievance against staff. Meanwhile, correctional officers get salad bars, grilled meals, and freshly baked pizza, while residents are fed repetitive meals such as bologna sandwiches or rice and beans. DOC only paid Aramark $6.56 per day per person for resident food, a number that includes the cost of staffing food service. One resident on a medical diet reported being served only broccoli for every meal, failing to meet their insulin needs. In addition, we found pregnant women were given an increase in fresh fruits and vegetables, but these options are removed postpartum. Next, commissary access in the DC jail is inequitable. Residents in restrictive housing faced a $25 weekly spending cap during the audit period, limiting access to hygiene products and food, while the general population residents could spend up to $125 a week. During the audit period, 9 formal grievances and 150 complaints highlighted commissary issues. Some residents relied on commissary to supplement what they reported as small, poor quality meals, yet options are nutritionally lacking, with oatmeal listed as the only vegetable and protein options being limited to meat sticks and pepperoni. Finally, logistical failures in food service are a major issue at the DC jail, or they were during the audit period. A single kitchen serves both the CDF and CTF, causing delays that exceeded the 45-minute limit of hot boxes, leaving residents with cold food during the audit period. Furthermore, no temperature checks are logged at housing units, raising safety concerns. A 2024 DOC survey found 51% of staff rated the current meal distribution system as the worst approach, where food is delivered to shared spaces between multiple housing units. Current plans for a central kitchen in the new jail risk repeating these same inefficiencies unless logistics, equipment, and staffing are improved. I'll now pass to Magdalena to discuss restrictive housing.
Hundreds of individuals are held in restrictive housing every month in DOC. At the end of the audit period, DOC reported there were 216 people being held in some form of restrictive housing, which by their definition is either administrative or disciplinary restrictive housing. And this includes 111 people who were in protective custody. Important to note, DOC does not include individuals in pre-hearing housing in their count of people on restrictive housing. They also do not include individuals being held in safe cells in their definition, although residents in those cells are allowed only 30 minutes of out-of-cell time per day. So these numbers are an undercount given in general solitary confinement is defined as being held for 23 hours or more a day without meaningful human contact. But even excluding people in pre-hearing housing, given the jail population at that time of 1,945 residents, this means 11.1% of the jail population was in restrictive housing, which is roughly twice the national jail average of 5.64%, as calculated by Vera Institute in their 2019 census of jails. As with all jail populations, the number of people in restrictive housing is a function of both how many people enter and how long they stay. And so bringing down the restrictive and housing numbers will depend on DOC addressing both of those factors. The conditions in solitary mean limitations on not just out of cell time, but also programming, visitation, and potentially communication with family members. A resident noted in an interview with CCE staff that while DOC does not use the term solitary confinement, the practice is used. She shared officers don't respond to people in solitary having mental health crises, and that people screaming for medical care may not be responded to for 10 to 15 minutes. She noted being in restrictive housing units have an overall negative impact on a resident's mental health and impact their personality. And the use of solitary confinement has been associated with increased violent incidents in facilities. States that have decreased the use of solitary confinement have seen decreases in resident on staff assaults, resident on resident assaults, and other serious incidents. I'll pass back to Crystal.
Thank you, Magdalena. Next, we'll be talking about grievances. Grievances, there were 4,291 informal complaints filed during the one-year audit period. Of these, almost 18% of grievances were denied. A grievance is how an individual who is at the DC jail is able to share any issues that they're having or any problems. The most common categories were improper staff actions or operations, which comprised of 40% of the complaints, followed by access to health, comprising of 12% of the grievances. CCE also only received grievances that were written by hand and that did not receive any that were completed via tablet. Multiple incarcerated individuals and providers have said that the grievance process was ineffective and led to many individuals unable to get a remedy due to its numerous steps, multiple forms, and time frame of responses. When the grievances did get attention, DOC's reply was often thought to be lacking by individuals who were incarcerated. When individuals did submit issues, many times they were found to be ungrievable. Upon review, 39% of grievances were considered ungrievable because the wrong form was used, leading individuals to not receive remedies for their issues simply because of a technical error. Residents have said they often lacked access to both grievances forms and the pencils needed to complete the forms. Residents said that they relied on service providers to independently make copies of the grievance forms to then be distributed to residents, and they also relied on case managers for pencils. Residents also say they didn't trust complaints filed on tablets, as they didn't receive a receipt. Receipts for grievances can be incredibly important if an individual decides to seek legal remedies based on an issue that they reported within a grievance. I've talked a little bit about tablets, but tablets are also a key part of how residents communicate with loved ones. But often tablets are unavailable or do not work. When residents file complaints requesting tablet access, tablets are frequently unavailable. Alongside issues of tablets, depending on which facility a resident is in, they have different visitation opportunities. Residents in CDF were allowed 2 45-minute video visitations a week, and those who have been housed in CDF for 60 days or more and are free of disciplinary infractions in the 30 days prior are eligible for 1 30-minute face-to-face visit, which is held behind plexiglass. CTF residents were eligible for one 1-hour in-person visit per week unless they have lost their visiting privileges through a disciplinary process. Most visits, however, are still conducted virtually. There's also a financial burden when it comes to phone and video visits, as many times residents have faced this financial barrier and cannot maintain relationships with loved ones. Residents could make phone calls during their out of cell times at 8 cents per minute and could also make calls via their tablets if they have one available to them. Alongside phone calls, DOC policy described that while video visits from one of the jail satellite facilities are free, if a visitor elects to conduct a visit from home, a $10 convenience fee is charged by the vendor. Other things that are not available to them are law libraries. One located in CTF and one in CDF were often closed and thus inaccessible to residents. Some residents were not even aware that the law libraries existed for their use. While residents have access to legal information on tablets, if they have a tablet, they reported it was complicated and difficult to use. Many jails also provide residents with copies of commonly used legal documents and as a way to protect residents' right to access the courts. One of these places is Virginia. DOC also could adopt these practices to safeguard residents' rights to access the courts. Next, I will be talking about programming. Regarding programming, there was a strong desire for additional programming in the jail from residents. DOC currently offers educational, vocational, religious, and artistic programs, many of which are run by volunteer organizations. Despite a wide variety of programs being offered, many residents did not feel prepared for release. Over half of residents surveyed in 2024 indicated they did not have employment set up once released, and only 36.5% of residents felt that their facility did a good job at preparing them for release. Only 1 in 5 or fewer residents responding to the DOC survey agreed with the statements, "This jail does a good job preparing people for release, there are enough staff to help me get ready for release, and the program in these facilities give me the skills I need to be successful in the outside." Programming is incredibly important for residents, as participation in programming can help residents prepare for release. Many people CC spoke to who have worked or who have lived inside the jail said that they thought that pre-COVID, the jail had considerably more programming. In a 2024 survey, 55% of DOC residents reported not being satisfied with the quality of programs and activities. There is also severe disparities in programming. Despite the interest in programming across the board, programming is not equally accessible to all jail residents. TDF had many programs that are not accessible to residents in CTF, largely due to issues with moving residents between facilities. This means that women who are only housed in CTF are unable to access most specialty programming available at CDF. In addition, programming not currently available to residents housed in programming is not currently accessible to residents housed in maximum security units and CDF. Finally, while there is religious programming, residents across different faiths have said that they were unable to faithfully engage in the religious practices. At times, when a chaplain was supposed to be present to facilitate religious practices, no chaplain was available. With that, I will go ahead and pass to Tracy for closing remarks.
Thank you very much, Crystal. So we hope that you found this information engaging, and hope that you'll continue to follow this information. On our website is both the full report as well as an executive summary. And at this point, we will take questions from anyone who has them. Just drop them in the chat, and I'm going to stop sharing so we can have a fuller discussion. Katie, do you want to see if there's any questions there for the team?
Yeah, the first question was about your deaths in custody slide, and it was over what period of time is the data in the table?
It is the period of time of the audit, which was July 1, 2023 to June 30th, 2024.
Yes, and I think you, as you said, it compared to 2019 data, which was the most recent available.
Oh, for the rates of death.
Yeah.
Yes. So that was utilizing the national survey of jails only takes place at large sort of interviews, and 2019 was the most recent full survey of jails.
And then these next questions are more broad, but first, how dire of a need is it for DC to get a new jail?
I'll go ahead and start, and then if other staff want to chime in, we feel it's quite urgent that DC get a new jail. One of the statistics that we found was that there were also hundreds of homemade weapons found during the audit period. Many of these were made from pieces of the jail itself, right, that break off and are able to be weaponized. There's also concerns that the jail does not have the sort of modern facility that has been shown to be safer than the linear design of the current jail. And there's inadequate space for programming. We know now that much programming is being done in vacant housing units, but these are not adequate. I think one of our slides show that people felt that the jail space was not conducive to programming and providing the sort of educational and vocational experiences that could help people when they are released. And I'll let any other staff who want to add a comment.
I will add that we do see a lot of physical condition issues, and sometimes it's hard to know if these are reoccurring issues and the same cells will have them week after week, according to the documents that we had. But a lot of these issues were also very hazardous. For example, there was one issue in which residents would be able to go in and out of their cells, according to what we've heard and from paperwork. So I think it's incredibly important that there is a new jail coming soon, because if the facilities just keep deteriorating over time.
Yeah, and just to reemphasize a little bit what Tracy touched on, a majority of residents live in the central detention facility, which has, unequal access to programming, a lot of the physical conditions issues that Crystal was just talking about, and the currently proposed plans wouldn't have the central detention facility being replaced for at least a decade. And so we think that a new jail should be made to get people out of the central detention facility quicker, which would include more general population beds. The other facility, the central treatment facility, has more specialized beds. Okay, and then I'll move on to the next question. What are the main concerns our organization has with the mayor wanting to push this project to a private developer? And the third question is, how much longer do you think CDF can continue operating as it currently is?
Well, I can talk about the first one. The second one, I'm not sure that we have a good handle on that, right? So, we've heard that they're working on fixing the air conditioning, and that's great, right? So that's one problem, but there's plenty of other situations that are concerning, and it's sort of a matter of, at what point do you stop trying to fix a broken car, right? The issues with the private funding, I mean, one of the ways that we're hopeful about this proposal is, as Katie mentioned, originally when they budgeted out for a single facility, they knew then in 2023 it was going to be pretty much $1 billion, and that's gone up since then as Mr. Donahue mentioned in the budget presentation. If private funding could potentially create a facility that meets the full needs to replace and demolish CDF, that could get everyone out of the central detention facility sooner. Our concerns are not repeating what happened in 2017 when they were looking at someone to basically privatize the jail. We would have serious concerns if that were the case. Because of the accountability issues, there's been many cases in both private prisons and private jails around the country about the lack of oversight that this results in, and the inability of a jurisdiction to really provide the services that they want to provide in the type of situation that they believe people should be living in. We don't know what the parameters are. As those of you who've sort of followed some of the concerns of the task force on jails and justice, the task force and many groups have not been satisfied with even the current plans that were put forth for the jail. Like there was no outdoor space, for example, for individuals. And as we noted, many people there are there for a year or more, which is a long time to never be outside. So, the questions that we have are about, what does the new facility look like? Who's designing it? Who will run it? And, who will be responsible for the programming and the services in it? So, I think we are waiting to hear more of the details and, and obviously are concerned about outsourcing this important government function to a private entity and relying on private markets. I'm not a financing expert. I don't know how much it might cost the district more over the useful life of the jail, but hopefully we'll find out more with time.
Okay, and kind of in tandem with that, sorry, Tracy, a lot of questions in your wheelhouse. Do we have an understanding of how the current budget, which removes money for the new jail, will impact the long-term timeline for the project?
Yeah, we do not know that. Like I said, ideally, it would mean they could replace CDF sooner. And we also want to like reemphasize that the current site of the jail is convenient for visitation. It's easier for family to visit there. And we do want to ensure that as these discussions take place, that the new jail would be where the old jail is on that site and not somewhere else in the district.
Just a couple more questions. One is, we are hearing a lot about plans, I assume, for the new jail. How do we know improvements to the jail won't get pushed or will get taken seriously? Are there any commitments from DC Council? Would that even be helpful?
We're hopeful. I mean, the Department of Corrections has their oversight hearing on Monday, and we'll be there to discuss some of these issues. We hope folks who have concerns will also come and voice those concerns. We believe that there are many of the issues that were raised that can be addressed quickly with adequate support. Issues around food, for example, could be addressed by funding the provisions of the Secure DC Act that improved food quality. Issues around overtime could be addressed by improved staffing and whatever is necessary to recruit that staffing. So we don't think that all of the issues that were raised here need to wait for a new jail, and we certainly hope that they do not.
Yeah, and the last question, there's a couple more now. So there's a question, there's an opportunity for a testimony on Monday at the first DOC budget hearing for public witnesses. What would you want folks to amplify if they testify? What questions do you still want DOC to answer? And I can start with the answer to that question, which is when we sent around our report, we have, a few infographics and findings highlighted. Our report is separated into 11 different sections by topic area. So I would, emphasize that's not a lot of time to testify. Whatever you most care about, there's probably some facts and findings and recommendations in our report. But if anyone else on the team has something to say.
Right. I mean, it's not the role of this hearing, this briefing to, sort of discuss advocacy more broadly. But, we do feel like the issues that are raised here are serious, and we hope that DC Council will be responsive to the issues that were really of greatest concern right now to the people living in the jail and working in the jail.
And then what is the plan? I don't know if we know the answer, but what is the plan for immediate staffing recruitment due to safety for staff and inmates?
I think that's an excellent question. to ask at the hearing and to, and hopefully, DC Council will ask of DOC. We know that there's been challenges in recruitment. We also know that, issues around contraband, issues around morale, many of them have to do with people who, and even the overtime, what are we asking people to do, and are we paying them a fair living wage to do that? So I think those are very important questions for the Department of Corrections and the administration and DC Council as well.
Okay, I think that wraps up the question. Somebody asked for the information for the budget hearing on Monday, so I just posted that in the chat. I do see there's one hand raised, and if you'd like to add your question to the Q&A, we're happy to answer it. Otherwise, we're also happy to follow up with anybody offline. All of our emails are on our website, as is the jail report, which is also linked in the chat. But thank you to everyone for showing up and showing your concern and care for these issues today. We really appreciate everyone attending.